Yes, ma'am.
All right. Chair Hinojosa and members, thank you for the opportunity to provide testimony on the budget today. My name is Kerrie Judice, and I am the Director of Policy and Advocacy at Tex Protects, where we focus on strengthening families and preventing child abuse and neglect. I want to start by thanking Senators Kolkhorst and Huffman for leading on the historic increase of $65 million through Senate Bill 24 last session. And that went towards strengthening families. And today, I'm here to talk about two main goals at Tex Protects. We want to make sure there is a full continuum of supports available in each community for families, and the second being we want to ensure that they are actually connected to what they need. We recommend increasing funding to two HHSC programs that did not receive an increase in funding last session, and those are programs that serve military families and fathers. Texas has the second highest population of active duty military members and is home to the largest veteran population. And research is clear that engaging fathers can keep their children safe from abuse and neglect. We recommend doubling the funding for each of these programs, which would help reach an additional 2,700 families and would cost $3.43 million per year total. We also hear from our wonderful providers that we work with all the time how families are presenting with more complex needs. And one solution, infant early childhood mental health consultation, is being piloted across the state. This is when a certified mental health professional, they come alongside early childhood providers who are already working with families. Current funding sources are either coming to an end at the end of this year or have a question mark for future funding. So we recommend $2.85 million per year to continue and expand their reach. Available resources must be met with actual connection. Whether that is 211, family resource centers, or Help Me Grow, we want better coordination and the ability for connectors to partner together. Improvements will help across the board, and ultimately, we just want to make sure that the state is efficiently and effectively serving families. Thank y'all.
Thank you.
Good afternoon, Vice Chair. My name is Brianna Waldock. I am also with Tex Protects. We work to strengthen families and prevent child abuse here in Texas. We believe that children should be with their families always. However, in situations where safety does not allow, we want to look to the next of kin in those situations. So I want to start off by thanking y'all for the support you've given to families in state custody, those kinship caregivers who are caring for kids in state custody. Today, I want to focus on the needs of kinship families who are caring for kids when the state does not have custody. These caregivers lack critical support because they don't always have legal authority to make decisions on behalf of the children in their home. For context, as far as numbers go, for every one child living with kin in state custody, there are 24 children being cared for outside of state custody. So these are big populations we're talking about, and they're grandparents, aunts, and uncles who have stepped up to care for kids in their lives that they know, and those individuals are preventing children from going into the foster care system. Last week, we participated with Texas Grandparents Raising Grandchildren, their advocacy day here at the Capitol, and they raised many difficulties that they have raising multiple grandchildren while navigating a costly legal system. Many of these caregivers are supporting young families on fixed incomes or retirement checks, and as we know, it is very expensive to raise a child. Most of these kinship caregiver families are not able to receive benefits for day-to-day costs of living expenses, clothing these children, and bringing food to the table. To help address the needs of these families, we're asking for funding to sustain and expand the current 4 kinship navigator programs that we have in the state. We're asking for $2.3 million to do that. These programs are currently housed at Phase under HHSC. Thank you.